My name is John Hayden Hancock, and I'm in nursing 1219.
Come in.
Good morning. My name is John Hayden Hancock. I'm going to be your student nurse today. I'm going to first provide us some privacy, and I'm going to provide hand hygiene. Could you verify your name and date of birth for me, please? Okay. So I've been told by your doctor we're going to be doing a blood transfusion today, and I'll first need to insert an IV. I've checked your allergies, I've checked your vitals, and I also have your written consent for this order. Okay, and I think we're good. Let's just get started. First, hand hygiene. I'm going to don my PPE. Okay. First, I'm going to be applying the tourniquet 4 to 6 inches above my insertion site. This might be kind of tight. I'm going to palpate the vein. Okay. Pop it. Next, I'm going to be cleaning my site inside out circles with antiseptic solution. I'm going to allow that time to dry, and I'm going to be applying my tourniquet again. Before I do that, I'm going to go ahead and prep my needle because the tourniquet can't be on for more than 2 minutes. Discard that. Okay. I'm going to apply my tourniquet again. Nice and tight. Okay. Bevel up. Pull the skin taut. Okay, I got that flash of blood there. I'm gonna get my pig ear ready. I'm gonna stabilize my catheter. Okay, screw that in. We'll make sure my clamp is open. And now I flush with 10 cc's. I'm gonna take that tourniquet off. Swab first for sterile. Pull back for patency. I've got that blood return, and now I'm just going to flush slowly. Okay, I'm going to watch for any air bubbles. I'm going to discard that. Stabilize the hub. And now I've already pre-labeled my dressing with my initials and date and time. I'm going to put that over the hub so we can be sure to assess it. Okay. Put that in a sharps container. There we go. Okay, now we're ready for prepping our solutions. So I'm going to be opening my new tubing. I have my medication order, and the doctor says to hang normal saline. I'm going to inspect for clarity, any kind of leaks, color, everything looks good. It's expiration date, good to go. I'm gonna move my clamp 2 inches below the drip chamber, and I'm gonna make sure that's off so it doesn't make a mess. Next, I'm gonna spike my bag. Since these are clean, just took that off, but you could always swab it for, make sure it's sterile. Spike. Okay, now I'm gonna hang. Make sure that's off. Turn this one on. I'm gonna give it a squeeze, fill it halfway full. I'm gonna be priming my tube with normal saline before blood. And I'm gonna open this roller, let it prime the rest of the tubing. I'm gonna be sure to watch for any air bubbles and flick them if needed for them to go away. Slowly coming. Okay, I'm gonna cut my roller off since it's already primed. I'm gonna go ahead and disconnect this, swab it, swab the end of this, and now our tubing is primed. Now that the saline's done, I'm gonna go ahead and label that with my name, time, date, since I've done that. Next, I'm gonna be prepping for the blood transfusion. For the blood, I know I have 30 minutes to do, and I also need another RN to verify the blood band, expiration date, unit number. I'm gonna be checking for expiration. Everything's good. Band number 0001215. Checking the band, 00125. Unit number, everything matches. Lewis Brown. Okay, we're good to go. I'm gonna be inspecting this for any kind of leaks. We're good. You have the written consent for this. Okay. You can swab this for sterile if needed. Okay, before doing that, make sure this clamp is off. That will make a mess. Swab. Connect. Okay, that's off. I'm gonna hang it. Now I'm gonna open it. Turn my saline off so they don't mix. And I'll give it a little squeeze. And I'll open my bottom roller, let it flow. And I'll set this at the correct flow rate that the physician ordered. And it'll slowly be into our patient's arm, but with a span of 4 hours only. Watch for any air bubbles. I took my vital signs before I gave this, prior to entering the room. I'll stay for an extra 15 minutes to observe for any hemolytic reactions. And then after that, I'll just be observing hourly. Okay, now the physician has ordered to discontinue. So now I'm gonna discontinue. Hand hygiene, new gloves. First, I'm gonna start by clamping all of my solutions off. I'm gonna go ahead and turn that off. Discard of tubing. Next, I'm gonna slowly lift all the edges. First, I'm gonna get my gauze for my patient. Ready? So I'm gonna lift the outside carefully. discard that. I'm gonna have a gauze on top of the site before I pull. Pull back straight how you entered. Inspect the catheter, everything's good. Into the sharpener. Inspect the site. I'm gonna get a new gauze for my patient. And I'm just gonna tape that down. I'm going to be sure to educate my patient about post-insertion sites if anything happens after. But, okay, we are good to go. Patient had the IV, everything is good.